hours. I'd like to introduce our next speaker. At my organization, I've been responsible for the Joint Commission accreditation for the last 17 years, and it's been amazing to watch the journey the Joint Commission has gone on. And I have nothing but respect for how they've changed and transformed their organization. So today we have a great speaker coming to us from for the Joint Commission, Miss Margaret Van Amringe, and she's got a master's in health sciences from Johns Hopkins. She is the Vice President for Public Policy and Government Relations at the Joint Commission and runs their Washington office, where they do all the coordination with CMS and working on public policy issues. And so for all of us in hospitals and healthcare, we see the huge impact coming from CMS and Joint Commission trying to harmonize with them, and so it's going to be an important presentation for us. Couple comments. Ms. Van Amringe was formerly the Director for Research and Dissemination at HRQ, and then had just a luminary career working in the Senate Majority's office, working at HHS in a number of offices, and so we'd like to welcome Margaret. Thank you.
Thank you for that kind introduction, and you could have said working in La La Land, because that's what it feels like some days in Washington. So let me give you a little bit of context. I'm supposed to talk about healthcare reform, but I think it's very difficult to talk about the status of healthcare reform unless one gives a little bit of background about what the environment is today in Washington, because that's coloring everything to do with healthcare reform. So, how do I advance these slides? Sorry.
Yeah. Click
Which one?
the green button.
The
on
green.
the top.
Okay. I should know how to do this, right?
There you go.
Okay, so I'm going to cover very briefly where we are now in terms of the fiscal and political situation in Washington, what's ahead in terms of the president's election, and also the SCOTUS, the Supreme Court of the United States ruling, where we think that's going to go, and drive for value-based reimbursement at the federal level, because all of these things are intimately connected. If I were going to say anything about the environment today in Washington and how it affects all of us, it's very uncertain. And this is a real problem, quite frankly. The uncertainty is in the political arena. Obviously, we have an election coming up. We don't know exactly what the congressional makeup will be. And we know that there's so much politicking now that it's almost a paralyzed environment. So that leads usually to not much getting done or very extreme things getting done. The legal environment, because of the Supreme Court, is uncertain, and financially, we've got a lot of uncertainty as well. We have the deficit, we have sequestration that is coming January 1st if nothing happens, obviously all of the economic policies, and potentially what's going to happen with war. Will we have any additional issues on terrorism? And I put global on because recently, if you've been reading the papers, you've seen how the situation globally is affecting us. The problems in Europe are substantial, and China is even slowing its growth. And it's very important because what happens internationally affects us, and what we do affects the international market as well. Possibly if our credit rating changes, that would have a large effect as well. But I think what's a very important message that many countries are learning is if you don't have a very sound healthcare policy and environment, that affects your ability to be competitive globally as well. So this uncertain environment is causing business to be very, very anxious. And you can see from here, and I don't know if everyone can read back there, but it says 50% chance of a double dip, 50% chance of red tape, 90% chance of political gridlock, a beautiful day for hiring. Not, of course. And businesses don't like to expand. They don't like to grow when there's uncertainty. And you're even seeing now that organizations, or I should say sectors like the defense sector and universities who depend upon government research, they're contracting. They're worried. And this is at a time when both Democrats and Republicans believe that job growth is the #1 priority for the country. So this is an old Rumsfeld quote, but I still like it. And it talks about the fact that there are things that are known knowns that we know, and there are things we know we don't. We also know there are known unknowns, that is to say, there are things that we now know that we don't know. But there are also unknown unknowns. These are the things we do not know that we don't know. So all I can say is in all of these unknowns that we have today, let's hope, and I'm very optimistic, let's hope that there will be some positive unknowns that will bring our policymakers together to help solve effectively some of the challenging problems that we're having in these severe economic times. So here's a known, though, and this is the fact that CBO, Congressional Budget Office, has said by the end of 2012, we are facing $1.2 trillion in the deficit. So also known to us is that it is rising every day that we speak, and it's due to things like aging, technology, new treatments, paying for volume as opposed to outcomes, also the fact that patients are usually insulated from the true cost. There's an awful lot that's going on that's bringing the healthcare sector, which is now 17% of our GDP, into a very higher rate of gobbling of that economic pie. Now, what's happened is that both Republicans and Democrats have agreed that you have to look at entitlement programs to affect this 17% of GDP. What's in dispute, of course, is how vastly they are going to affect the entitlement programs. So what you have is a very icy